I've been asked by my colleagues as the chair of the Council of the Federation to contact the Prime Minister immediately after the meeting, after this meeting, and let the Prime Minister know exactly of the priorities of the provinces and the territories, and I will be doing that. You should also know that certainly part of the continued action plan for the provinces and territories will be to be very vigilant about those populations who are most vulnerable to H1N1. For the various reasons we talked about yesterday with the Inuit, with the Aboriginal leaders of Canada. But preparations have obviously been underway since the original outbreak, and no one has stopped working on this. I mean, that was pretty clear in that room. Everyone understands the priority this is. Obviously, I can speak very directly to my province, but the story here is similar to every other province in terms of working specifically with those vulnerable populations, with intertribal health authorities, but also with making sure we have essential services plans and protocols in place. And that work is being done. And the premiers want to be very clear to the people they work for at home, to all Canadians, that preparations are underway, that the partnership is working with the federal government. We do want the federal government to continue to take its leadership role. This is a national issue. This is a national I mean, the pandemic, of course, is international. So as it relates to Canada and our provinces, this is a national issue, and we want to encourage the federal government to continue their leadership and responsibilities in terms of dealing with what is a national challenge to the health of Canadians, possibly. Susan?
What are those priorities then, I guess, moving forward? Is there, in your phone call with the Prime Minister, what's that list you're going to give of priorities?
Well, I mean, there's a number of things we talked about very specifically. There's the matter of protocols. We know that health is delivered by our Constitution. It's delivered in the provinces. We each have very capable chief medical officers who we entrust together with their teams to make decisions like, if there is an outbreak, what's the response? What's the response in terms of education for the public? What's the response? And there had been debate in the spring, you might remember, about different approaches to whether schools should remain open or not. Each province has that responsibility, but I think there's always the opportunity to continue, and our chief medical officers have done that, to make sure we're sharing best practices, to make sure that there is also this national approach through the leadership of the provinces. But those are some of the specific things. I mentioned protocols. Susan, I'd also mention the vaccination issue as well. Obviously, that's very important. Not just from the access standpoint. We've made some decisions in the province here around that, but in education. You know, Premier Dewar reports, for example, that with respect to the regular flu, if I can call it that, the uptake for available vaccinations in certain parts of his province might be 15%. In other populations, it's 90%. So that speaks to the need to make sure there's an education component done here. And I think that here again, there's an important partnership between the federal and the provincial governments. The bottom line, though, I think Canadians want to know that the governments are going to be working together at every single level and putting their health and safety first, and that is exactly what we intend to do. Yeah. We're not going to worry about that. We're going to make sure we do whatever we can to have the vaccine available to those who need it. We've got a plan in terms of our residents. We've got a first responder plan, and I think that's what the premiers were talking about this morning. I mean, I don't think Canadians are really interested in a debate between levels of government about who's paying for what. They want to make sure there is preparedness, period. And we're going to worry about that first, and all the other stuff is not as important.
Takes off then, H1N1 takes off this fall, what will Canadians notice that's different than when H1N1 was big a couple months ago or whatever? What's the big difference?
Well, I think, and again, I apologize for speaking to the Saskatchewan experience, but I know our chief medical officer and her team were like every other chief medical officer and their teams across the country in uncharted territory. There's no question about it. But it didn't take them very long to get very organized, to get very, very prepared, to provide the public the information they needed, to provide the responses they needed, to start to do an inventory of potential available vaccine. to just run down the checklist for the message to be sent to the rest of our government, crown corporations, etc., that we need an essential services plan, possibly if the outbreak gets worse, and to follow the protocols that are in place as a result of SARS. I mean, SARS unfortunately happened, and perhaps BC and Toronto and Ontario were more significantly impacted. But the lessons learned, I think, were learned by everyone. And there have been lessons learned since the outbreak of H1N1. I think we're all going to be. There's still more work to be done. We have to continue to work to be prepared for this in every way. But I think we're ahead of where we were then when it first started.
So I'm trying to understand how Clear National is any different than what's been going on already.
Well, I mean, a couple things. What's been going on already since the outbreak of H1N1, and I tried to just highlight this a moment ago, has certainly been imperfect because it is uncharted. This is unprecedented, what the H1N1 virus, obviously, by definition. But I think each province has quickly developed and deployed plans to deal with the situation in their area. The national government has become seized with the issue with respect to their jurisdiction. Really, as a national government, this is a national. It's very much a national issue, and so part of this is letting Canadians know that there's been progress made, and we're building on that together, and we're going to be ever more diligent and vigilant on this particular issue. And that includes, for example, when I'm done here, I want the Prime Minister to know exactly where the premiers were coming from. I want the Prime Minister to know that we as the Council of the Federation welcome their existing leadership they're showing, but we need that to continue because, of course, the national government has responsibilities here as well.
The other question is how things are going to be different because of the meeting.
Well, I tell you, I know every single premier in advance of this meeting, in advance of yesterday's meeting with Aboriginal organizations, and obviously prior to that, has been focusing on this issue. I don't think there is. I respectfully disagree with you. I think Canadians want to know that this is a top priority for their premiers, that the premiers and the federal government are going to work together. They're not going to worry about other sort of some of the other issues that can be sorted out later, that we're going to make the plans that we need to for fall, and that's in terms of vaccinations and the protocols needed to make sure that we do everything we can for the health and safety of Canadians. You know, we noted in the press release today, and we talked about it here today as well. I think all premiers recognize there is better command and control apparatus with the federal government. Probably in the wake of SARS. I think we've all learned something. There's certainly the national government has. We know the national health minister has been in constant contact with counterparts. I think there's an understanding by the federal government, and we encourage that to continue, that there is a national role. This is a national issue. And though health care is delivered provincially, and there are provincial obligations here, we have a national government that needs to continue to show the leadership that it has. Thanks very much. I got one more. I have no plans on going to Copenhagen. I think it's important, as the federal government considers any treaty, that they engage the provinces ahead of time. It's the federal government's responsibility to negotiate those treaties with other countries or trade agreements. But I also think it's the federal government's obligation, and I think other premiers would agree, that they consult with the provinces. We have been consulted on a number of international issues with respect to the environment. Each province is engaged bilaterally with the federal minister, and that's also happened. That's also happened on the trade issue. But I think the premiers have to make sure it continues to happen. Thanks very much.